It's 11 a.m. here in Seoul. I'm Oh Seung at the Arirang News Center. We're breaking into our regular programming to bring you a live briefing from the South Korean health authorities on the coronavirus outbreak here in the nation. In just a few moments, we're going to cut into the briefing at the Sejong Government Complex with simultaneous interpretation available in English. So we are going to go into the briefing room where Kim Kang-nip, Vice Health Minister and overall coordinator of the Central Disaster and Safety Countermeasure Headquarters, will be providing us with the latest updates and the latest figures on the COVID-19 situation here in the country, especially with the cluster infections that we've seen recently. And it looks like the briefing's just about to begin.
We also have sign language translation available. First of all, here is Mr. Kim Kang-nip with the briefing on COVID-19 response. Let us now begin our regular briefing for May 27th, Wednesday. As of today, midnight, we have 40 new cases as of yesterday. And in relation to the Itaewon Club, and we have other local transmissions amounting to 37, and rest of the 3 are imported cases. And as of today, we have a total number of confirmed cases standing at 11,265, and a total of 10,295 have been discharged following full recovery. A total of 701 people are in quarantine undergoing treatment. Fortunately, we had no additional fatality, and the death toll remains unchanged at 269. This morning, the KSDC held a meeting presided over by Prime Minister Chung Se-kyun, and we discussed diverse issues, including the additional confirmed cases in the metropolitan area and the revamp of the dining culture here in Korea in face of the COVID-19 outbreak. And Prime Minister Chung Se-kyun has also highlighted that we need to curb silent infections among young people, and he asked the young generation to have a sense of responsibility as members of the society and actively take part in distancing in daily lives. And he also told the public that as for the people who work at private academies, schools, places of worship, these people need to continue to stay vigilant and cooperate as they meet a wide range of other people. Today, the KCC also dealt with the issues of the updates on the confirmed cases in the metropolitan area. And in relation to Itaewon Club, we have an increase of the number of COVID-19 cases. And we now have 275 people who are related to the Itaewon Club case. And the quarantine authorities are currently carrying out massive diagnosis of these testings. And we also have exerted our full efforts to diagnose these patients at an early pace. And today, as of 9 a.m., in relation to the logistics center at the Bucheon city, we have 38 confirmed cases. And after that, we will expect the number to increase further. And yesterday at the Bucheon Sports Complex, we set up a temporary screening clinic, and we also mobilized a total of 62 people who will be working there for the next few days, and will be carrying out swift diagnostic testings for all of the 3,000 workers who are working at the logistics center. And aside from these cases, we continue to witness local transmissions, and we ask the people to be careful when you go to multi-use facilities like restaurants and other meetings. And we are staying on alert, and we are monitoring the situations, and we will be carrying out extensive and swift diagnostic testing to identify patients at an early stage. Today, many of our students in elementary school and kindergarten have resumed their offline classes, and they are returning back to school. And we well understand that many parents are concerned about their safety. And therefore, the quarantine authorities are closely cooperating with the education authorities, and we are intensifying our infections monitoring And in order to curb these local infections to connect all the way to the schools, we believe that it is important for the public to take part in the distancing measures. And we need to also ask you to cooperate with our epidemiological investigation if confirmed case is confirmed. And the KCDC is currently unveiling the time and the list of the locations that the confirmed cases have visited. So if you have visited such places during the respective specified time periods, you are advised to visit a screening clinic and get tested as soon as possible, regardless of symptoms. Recently, we have seen a case of the Incheon private school academy teacher, and if false information is testified in time of epidemiological investigation, this can lead to a wide range of local infections and chains of infection. And if the false testimony is given at a given time, the quarantine authorities will be able to successfully identify its truth, and this also delays our quarantine process. So please remember that this is very dangerous for our society as a whole, and please comply with our quarantine measures very strictly. These include social distancing, washing of your hands, ventilation, and disinfection, and wearing of your face masks. These are very important in curbing local transmissions, and they are also very important within office spaces as well. Recently, when we look at the latest cases, when we look at the cases, places where quarantine measures are well kept, including hospitals and call centers, we have not yet had a surge in the number of confirmed cases. And as for the logistics center, we need to identify and look more into the depth. However, we believe that as for the Itaewon case, we did not have a full compliance to the quarantine measures. If these quarantine measures are not well kept at office spaces, they could lead to harmful effects. Above all, right now, many medical staff members are working at the front lines to combat the disease, and please do not forget their dedication and sacrifice. During the past 4 months, they have been putting their utmost efforts to treat many COVID-19 patients, and thanks to their efforts, we are resuming our daily routine. And I ask the members of the public to please remember their sacrifice and dedication, and we ask you to also become responsible agents of quarantine in our social society. And in the KCC meeting, we also discussed issues of the use of air conditioning at multi-use facilities, including schools. And we have discussed the issue and the need of the revisioning of these guidelines. And earlier, the government has disclosed guidelines for 31 specific locations. And after our announcement, we took and reflected the experts of the experts, and we also revised our guidelines. And as for the guidelines that need they need guidelines. As for the use of air conditioning and mask wearing, we have also made some revisions as well. As for the 9 areas that are closely linked with our daily routines have been revisited, and they include the banks and also other works that need to have contacts. We continue to ask for non-face-to-face contact in these areas. And as for call centers, we continue to advise you to keep distancing. And as for beaches, we ask the parasols to be set in place with 2 meters of distance with each other. We also provide detailed guidelines that the visitors need to keep at beaches. And also the these guidelines regarding the air conditioning have been revised as well. And as for the air conditioning, we have a high risk of a droplet infection when the air conditioner is used in a confined space. We believe that in every 2 hours, we need to ventilate the space. And if the ventilation is inevitable, you need to wear face masks. All of the members need to wear face masks and have a strict visitor log as well. And it needs to make sure that the air conditioning, the wind does not come in direct contact with the people. And this is a very mandatory aspect. And as for the mask wearing at schools, it is as follows, including indoor spaces like corridors and classrooms. The principle is that all of the students need to wear face masks, but we also included some exemptions. At the outdoor facilities as well as the playground and the fields and outdoor classes. And if there are some small group special classes, and as for the students who have some health conditions like headaches or dizziness, we have considered them as exemptions. And we ask the students to bring additional face masks so that if their face masks are contaminated, they could change into new ones immediately. And we also revised some of the guidelines as well. And as for the religious facilities and other multi-use facilities that need to have the visitor log, we ask them to keep these information for 4 weeks, and they need to be discarded afterwards for the sake of private information, privacy. And we also revise some guidelines as for the transportations, including buses and airlines, and they will be disclosed to the public starting from today, and they will be also disclosed to the students through the Education Ministry. And the government will continue to revise our guidelines going forward to meet the practicalities on the fields. And we ask the members of the public to be disciplined with these guidelines, and please continue to comply with them going forward. Nextly, we have some of the measures for the revamps of the dining culture that has been discussed and disclosed on 8th of May. And we have been holding campaigns to use private plates and personal plates. And we also have these made in brochures, and we are disclosing this to the public. And until the June 7th, we are having a nationwide campaign with the public to designate model restaurants. And these information are also shared with the local governments. And we also continue to ask the public to participate in our campaign. And we will be carrying out such campaign going forward as well. And as for the companies that participate in our revamp of the dining culture campaign, we will be providing them with incentives as well. Today, many of our students are returning back to school, and we now have continued concerns about the health and safety of our children. Ever since the COVID-19 outbreak, we have been realizing the very important and value of our daily lives. Of course, we cannot completely return to COVID-19 free days. However, we believe that we can recover our daily routines once we keep our quarantine measures strictly. And please continue to stay vigilant, and please play respective roles as the members of the society. And if all of us play such roles with concerted efforts, we believe that we can successfully overcome the outbreak. And please encourage each other going forward. Thank you very much.
That was a live briefing from the South Korean health authorities updating us on the COVID-19 outbreak in the nation. We just heard that there are 40 additional infection cases of COVID-19, bringing the total to 11,265. There were no new deaths reported, meaning that the total stays put at 269. Well, that wraps up our coverage of this morning's briefing. Thank you for staying with us, and we'll be back shortly with our regular newscast at 12 p.m. Korea time. Bye for now.